Hello everyone, this is Dr. Bob DeMaria, the Drugless Doctor, with another episode of Ask Dr. Bob. Very interesting questions. Question number 1. Dr. Bob, can toxins pass from the fillings of a mom to an unborn child? The toxicity from those amalgams. So I did some research on it myself, and basically the answer is yes, they can. They can pass through the placenta and the fetal circulation and breast milk. Now listen, if that was a major issue though, I think that there are so many amalgams out there that we would have a major meltdown of the human species. So is it really an issue? If you have a lot of dental work and possibly some dental infection going on, it could probably be more of a challenge. We encourage the use of an item called the chlorella that helps take care of the mercury and other toxicities that you may get from the environment. So we had someone talk about fruit, and I think that there's some confusion about fruit with so many individuals. From my experience, and we've been working with patients since 1978, we have noticed that people who eat fruit have pain and inflammation in their body. The basic fruit that we encourage people to eat would be at least a half an apple a day. Pears and plums are also okay, but in all of my research, fruit can put compromise to the body, causing inflammation. So I don't eat fruit except a half an apple every day. We had an individual that had quite a detailed question, wanted to know about pain in her body and all the items that she's taking, and she eats organic, and the bottom line was for this person, she's not been able to sleep on her left side, and she wants to know my thoughts. So if it's a heart issue and you're laying on your left side, you're not necessarily going to get pain and inflammation. Structurally though, if you have a problem with your spine and you're laying on your left side, that could cause an issue. So if you're having pain and burning in your body and you're lying on your left side and you've tried everything, you may consider having some spinal x-rays taken in a standing or a sitting position and address that accordingly. Dr. Bob, macular degeneration, what can you suggest? Somebody wants to have injections. Well, what we have learned over time is cruciferous vegetables will help macular degeneration. We use a product in our practice called Optic Plus. Cruciferous vegetables was broccoli, cabbage, and cauliflower. Dr. Bob, you were talking about MS in this past month and wanted to know about ALS and MS. They come from basically the same physiology breakdown. We really focus on proper fat and oil metabolism. I also know that B6 may help someone with ALS, but B6 will help people with poor fat metabolism. We talk about this in our books, especially Dr. Bob's Trans Fat Survival Guide. I would encourage you to have an essential fatty acid blood spot test done to determine the exact levels of oil in your body. Dr. Bob, what can you do for puffy eyes? Well, puffy eyes could be a kidney involvement. We use a product called carbamide, and carbamide helps get rid of extra fluid in the body. I would definitely make sure that you have enough Celtic sea salt or minerals in your body and protein. Drink plenty of water. That'll help make a large difference. So then we talked about naltrexone on one of our prior tips and Ask Dr. Bob questions, and this person just brought a point home about LDN, which is the low dose naltrexone, using it for pain and fibromyalgia. And I had mentioned in the last time that we were talking about naltrexone for addictions, which when somebody has fibromyalgia, we want them to avoid sugar. We want them to work on their adrenal glands, minimal fruit. Citrus can create challenges even with fibromyalgia. So I would eliminate fruit, increase protein, and eliminate sugar. You want to focus on proper adrenal gland function. We had an individual, we had a friend who posted an article on one of their blogs, and she had been to an endocrinologist and had a lot of challenges going on in her body, and she was talking about thyroid dysfunction, which is very common. If you think you have a thyroid issue, you want a T3, a T4, a TSH, and a TPO, and you want to be supplemented accordingly. I'm not telling you to get off your levothyroxine or your Armour, but you want those tests done. And I'd encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones and use it as your reference guide of what you're supposed to do. My name is Dr. Bob DeMaria, and thank you for joining us.